Good afternoon, everybody. Thank you for coming along. Can I begin today with the usual update? As of 9 o'clock this morning, I can confirm that there have been 1,059 positive cases confirmed. That's an increase of 165 since yesterday. And as always, we are clear that these numbers will be an underestimate. I can also confirm that as of last night, there were 72 individuals with COVID or suspected COVID-19 in ICU. And it's with sadness that I must also report a further 8 deaths of patients who had tested positive for COVID-19. That takes the total number of deaths to 33 in Scotland. And I obviously want to extend my deepest condolences to all of those who have lost loved ones. And again, thank our NHS staff who continue to care for people suffering from this virus, and indeed thank the many other people who are helping to keep essential services going at this extremely challenging time. I think it's even more appropriate than usual to start with a reference to those who work in our NHS and care services, since we, like so many others across the country, joined in the applause for NHS and care staff at 8 p.m. last night. And I hope that that showed clearly to those working in our health and care services, although I hope this was never in any doubt, just how much the entire country appreciates everything you're doing on our behalf. And that ties into the most important message that I want to convey this morning. Expressions of solidarity like those we saw and heard last night are really important, and I hope they are welcome by those who work in these services. But for all of us, the single most important way in which we can show our support for the NHS is by staying at home wherever possible. We're about to go into the first weekend since the lockdown measures were announced. And I know that many of you watching will already be struggling with being cooped up in the house as much as you are right now and being unable to do all the normal things that you would normally be looking forward to doing at a weekend. But it is vital that all of us stick with this. The most important thing all of us can do for the NHS is to follow the advice and to stay at home wherever possible. And to make sure that we can have the biggest impact on slowing down this virus, you should only go outside for a good reason, such as buying food or essential supplies, travelling to essential work, exercising once a day, or providing care or assistance to others. And when you do go outside, there shouldn't be more than 2 of you in a group unless all of you are from the same household. The regulations which give power to enforce these rules came into force last night, and I want to say a special word here for our police, who are also being placed under real pressure by this pandemic and who are doing an exceptional job on behalf of all of us. But my fervent hope and belief is that the police and others will not need to enforce these regulations very often, because they simply enforce the public health guidance that the vast majority of people across the country, and indeed the vast majority of businesses, have been complying with all week. And I'm grateful to everybody for doing that. I know that these restrictions are tough, and that for many people, as I said a moment ago, they're going to feel much tougher as we go into the weekend. I'm thinking particularly of children and young people over the next couple of days. A weekend at home may feel especially difficult for you. So I hope you stick to the rules, do what you're told by your parents and carers, but also remember to have fun. And I've seen lots of examples on social media of young people coming up with new and inventive ways to have fun while in the house. But I'm also thinking about grandparents like my own mum and dad, who usually look forward to a visit at the weekend. And I'd say to young people, make sure you pick up the phone to your grandparents this weekend or FaceTime them to tell them how you're getting on, but also to check in on them and see how they're doing. I'm sure they would really appreciate it. But I want to just remind people and underline why these rules are in place. It is because they are vital. Staying at home, more than any other single measure, is the way in which we can support and protect our NHS, and it is ultimately the way in which we can all contribute to saving lives. I want to touch on a couple of other points very briefly before I hand over to the Chief Medical Officer and then to the Cabinet Secretary. I spoke earlier in the week about the importance of looking after our mental health during this period as well as our physical health. The Cabinet Secretary will say a bit more about this, but I can confirm today that we are putting an additional £3.8 million immediately into the NHS mental health support services. 500,000 of that will support the breathing space phone line and web service, and 2.1 million will be for the NHS Mental Health Hub, which offers advice on wellbeing and mental health issues to people who have called the NHS 24 service. The Mental Health Hub will expand its staffing in the coming weeks so that it can become available to the public 24 hours a day, 7 days a week. And I can confirm that we've added a dedicated page for mental health information onto the NHS Inform website. So if you need support over this next period, as many of us will, then I would encourage you to look at the NHS Inform website to find out how you can get more support for mental health and wellbeing. And lastly, I want to turn briefly to the economy. I chaired earlier this morning the Cabinet Subcommittee on the Economy, which discussed how we can continue to do everything we can to help businesses. We've already announced a £2.2 billion package of support. Amongst other things, that provides grants for many small or rural businesses and full relief and non-domestic rates for all premises in the retail, hospitality and leisure sectors. We also welcomed yesterday's announcement from the Chancellor of support for self-employed people. That offers the sort of support that the Scottish Government and many business organisations and self-employed people themselves have been asking for. We do, however, have some remaining concerns about some of the potential gaps and also the fact that people might have to wait until June to receive money. That will be immensely challenging for many self-employed people, and so obviously we hope that the UK Government will speed up that support if possible, although I do recognise the scale of what they are trying to do. Kate Forbes, the Finance Secretary, will be speaking to the Chief Secretary to the Treasury later this afternoon, and of course I want to give an assurance that the Scottish Government will continue to look at what more we can do to help those who are self-employed and indeed others who are being affected in different ways. Can I also once again urge banks, landlords and other creditors to be flexible. That will be important in many situations during this crisis, and it will clearly be essential when dealing with self-employed people who are facing cash flow difficulties which are in no way their fault. Now, I'm about to pass on to the Chief Medical Officer, so I want to close by simply reaffirming the message that I set out at the start of my remarks. We're just entering our first weekend in lockdown, although I'm afraid it won't be the last weekend that we go through with these measures. So we must, all of us, continue to reach out and support each other in every way we can, even as we keep our physical distance from each other. And above all else, we must continue to do the right thing for the sake of the National Health Service and those who are most vulnerable to becoming seriously ill and dying from this virus. And that means staying at home. And by doing that, every single one of us in this collective national endeavour is helping to slow down the spread of this virus, protect the NHS and save lives. And we're all doing our bit, I hope, to get closer to the time when we get out the other end of this and can start to resume our normal lives. So my sincere thanks again to everybody for your cooperation, and I hope all of you have the best weekend you can in the current circumstances. And I'll now ask the Chief Medical Officer to say a few words.
Thank you, First Minister. I was quoted yesterday in some of the press as estimating there were between 40 and 50,000 people in Scotland with coronavirus. While it's dangerous to go day by day, I want to really emphasise that I would now be estimating that there are more than 65,000 people in Scotland infected. The importance there is that only 1,000 or so people have actually been confirmed. So the vast majority of those people maybe do not realise they have coronavirus or perhaps have symptoms, and thank you to them for self-isolating from keeping away from other people. I can't emphasise enough how important those words from the First Minister have been about this weekend, about life changing, and about people not mixing outside your own household. There will come a time that I'll be able to talk to you about the numbers being infected and that rate slowing, but that time is not yet, and that time will not be for some weeks to come. The more that we can do now, the more that those numbers do not incrementally rise every day, the better that we will have our NHS to support us, and also the fewer lives will be lost. Last night I stood on my own doorstep and clapped my NHS and care colleagues, and Twitter tells me that that is the first time I've been seen smiling for quite some time. So I felt very emotional. I felt very proud to be part of the NHS, and for all of those of you who are finding this difficult and will find the weekend difficult, be reassured that my NHS colleagues really appreciate it. You are keeping them safe so they can keep us alive.
And I was one of those that was encouraged to see the Chief Medical Officer smile last night. Can I hand over to the Cabinet Secretary for a few words before we open for questions?
So I want to speak briefly about exactly what that additional funding support for mental health will offer and will do, and that includes for our NHS and social care staff. We understand very much that this particular time is causing many people real anxiety and concern. NHS 24 has already seen an increase in the number of calls that they are taking. So the £3.8 million does two things in particular. It does, as the First Minister said, allow us to scale up the mental health hub to 24-hour cover by bringing in additional psychological well-being practitioners and mental health nurse practitioners, and we will also benefit from the involvement of clinical psychology students who are not only applying their expertise but themselves getting valuable experience in doing so. That will allow us to increase both the telephone and the web chat breathing space offer for individuals, but also, of course, for our NHS and social care staff. Additionally, the funding will allow us to offer an increased service through digital cognitive behavioural therapy. That gives support to the public with very specific issues around anxiety, sleeping problems, depression, and so on. It allows some of that treatment to be delivered digitally, thereby meaning that people don't have to travel in order to get it. Of course, where there are additional clinical needs, then that will always be referred on to a greater level of clinical input. And as was said, the NHS Inform website will be updated in order to ensure that people know what support is available, how to access that support, and how to have some of their anxieties and concerns talked through in a safe way with experienced advisors to help them work through how they, for themselves and perhaps for their family, can support their mental health and well-being. It really is very important in times that are very different for everyone that we all pay attention to our own mental health and to the mental health of those around us and treat that as seriously as we would any physical problem or difficulty that we might have. So this additional support is part of all our work to ensure that people are supported to do just that.
Okay, thank you. Cabinet Secretary, yes.
First Minister, can I ask your thoughts for Boris Johnson, who's tested positive for the virus, and also there was much discussion about the fact that he was tested, that Prince Charles was tested. Is that a valid discussion, and what do you think of that, and can I ask, have you been tested?
No, I have not thus far. Can I firstly say I send my very best wishes to Boris Johnson and to his family. I've just seen him post a video and that would certainly reflect what he said, that he's suffering from mild symptoms, but I don't underestimate for anybody how difficult it is to be positive for this virus. So I'm certainly sending my best wishes to him for a very speedy recovery. Should I, as First Minister, experience symptoms, if I need clinical advice, obviously I would take that from my own GP. I would follow all of the advice that I'm asking others to follow. In terms of testing, I would take the advice from the Chief Medical Officer, who, with her colleagues across the UK, look at the protocols that would be in place for these kinds of eventualities. So, Catherine, I don't know whether you want to add anything to that.
The four Chief Medical Officers have discussed and agreed a protocol for very significant senior people in government to be tested only if there are clinical reasons. In the first instance, as you would know, the test is not going to be positive or useful if people don't have the appropriate clinical symptoms, but also this would be for significant people, the loss of whom from government would make a big difference to our coronavirus effort.
Yes.
I've got a couple of questions about the police law that you can see in a row, if that's okay.
Okay.
So, firstly, is it appropriate to use the police helicopter to find and fine groups of children if they're congregating in parks? Given issues around the oversight of Police Scotland more generally, are you satisfied with the checks and balances over the additional use of powers at the moment? And we're also hearing that some officers officers in general are being classed as category 2 key workers, leading to some concerns around childcare. Could you offer any clarity around that?
Okay, on the first issue about the use of police resources, that's an operational matter for the Chief Constable, and it would not be right for me to second guess that. However, what I would say is that we are not asking people to abide by these rules lightly. I mean, I don't relish standing here as First Minister, and I'm sure the same is true of the Prime Minister and the First Ministers of the other nations in the UK. I don't relish standing here asking people to impose such significant restrictions on their own freedoms and way of life. And I certainly don't relish being in a position where we have to have powers to enforce that if necessary. We are doing that because the price of not doing that is even more significant and will be paid in the lives of many people who will die from this virus, perhaps in part because our NHS will be overwhelmed that would otherwise not have to die. So I'm asking people to think about the collective good of the purpose of these measures. And you know, my strong impression is the vast majority of people are absolutely complying with that because they know it's in their own interest, they know it's in the interest of the people they love, and they know it's in the interest of the NHS. And we saw that outpouring of support and gratitude for the NHS last night at 8 o'clock. In terms of the oversight, these are exceptional powers, and the legislation has within it review requirements, and the legislation is time limited. And it's important in any democracy when we are asking people to restrict how they live their lives that those checks and balances and safeguards are in place. And I'm satisfied that they are. The Scottish Parliament, as did the Westminster Parliament, albeit in an accelerated, truncated time frame, discussed these matters last week. And I think everybody understands that in exceptional times, facing an exceptional challenge, we need exceptional measures. But it is important that these are absolutely time limited. And forgive me, what was your third question?
Around the key worker
Key workers, so yes, we will continue to work and talk to organisations such as the police about how we make sure that we provide as much flexibility around childcare for key workers as possible. I gave figures yesterday, or the day before, I think it was yesterday, that on the data we've collected so far, there's only around 1% of children at school. We don't want that to rise significantly because there is a public health need for us to limit the number of children at school, but we can continue to talk to key organisations about their needs so that we are protecting the frontline workforce. And if there is a need on the part of the police to do that, then we'll engage in those discussions. Yes.
I just have a few questions on the critical issue of PPE for health workers, if that's okay. We're still hearing widespread concerns from frontline staff on this. Why is that, and can you promise that they will get the correct, proper equipment they need by Monday? We also understand the UK government is moving to having all healthcare staff wear PPE, even those who are not dealing with infected patients. Are you going to change the advice on that in Scotland? Is that going to be something Scotland's going to follow on? We're also hearing unconfirmed reports of intensive care staff who have contracted the virus. Can you provide any clarity on that? And lastly, we're also hearing medics saying that they've been told not to talk to the media. Do you have concerns about medics not being able to voice legitimate concerns around this protective equipment?
Well, let me try and take those questions briefly in turn, and then I'll ask both the Cabinet Secretary and the CMO to add. On the question of the media, I absolutely believe that medics or anybody working in our health service should be free to talk to the media if they think that is important. We've got very strong whistleblowing rules and laws, and it's important that they are respected. So I would not in any way condone people being told that they were not able to do that. But I would also say that I don't want anybody in the front line of the health service feeling that they have to talk to the media. If there are issues, they should come to government, and we will strive to resolve these issues as much as possible. In terms of your point about guidance, we have Health Protection Scotland guidance, which sets out, and this is expert-driven guidance, it's not politician-driven guidance, about the types of PPE that are appropriate for different groups of staff in different circumstances. We will continue to keep that under review, and if it is thought that there is a need to change that for good expert clinical reasons, then of course we will consider that. In terms of the supplies, we are, and the Cabinet Secretary covered some of this yesterday, we have good supplies of all of the key pieces of kit around PPE in Scotland right now. We have had some issues with the distribution and the supply of that to the front line, and there have been changes made to that to make sure that they get to the front line more quickly and in a much more streamlined way. And we continue to want to hear where people think there are issues so that we can get onto that immediately and address it. So I'll hand over to the Cabinet Secretary to say a bit more about that. On the issue of intensive care, people contracting the virus, I suspect issues of patient confidentiality will mean we're not able to say much more about that, but I'll hand over to the Chief Medical Officer to see if she wants to add to anything that I've already said. Jean.
As the First Minister said, we do have sufficient supplies of all the items of PPE. We constantly are reviewing that, of course, against the volume of orders coming in and making sure that the supply chain at the other end is filling up those supplies. We've improved the distribution channels for PPE, which will be in place from Monday. And that means that there is now a direct distribution channel from our national stock holding place direct to social care and care in the community via the local authorities. There will be a direct distribution channel to primary care, which of course picks up community pharmacy, and one direct to hospital-based settings. The distribution of PPE will be against the clinical guidance about what clinical situations require which items of PPE. And so we follow the clinical guidance in terms of what goes out and what is distributed. And in addition, we have put in place, in order to more quickly respond to individual instances that are raised with us, either through social media or through email or however it might come in, to make sure that we capture all of those, and that we then have a targeted response to each of those individual situations as best we can, in order to address those whilst we make sure that the distribution channels are working well.
I think you probably know what I'm going to say. As a doctor, I wouldn't comment on any individual cases.
Okay. Yes.
A couple of things. On volunteering, you spoke last night a little bit about a national hub for volunteering. And charities have said today that they've been overwhelmed with the number of people that want to help in any way that they can. I wondered if you could provide any more detail on what kind of thing the government are looking for people to do, when a kind of national hub might be in place, and what that would involve people doing.
We're hoping within literally a couple of days to have what I described last night as a national portal, which would be a central point where people could register their desire to volunteer and a little bit about what they think they can bring to that, and then we would disseminate that to local level depending on what the nature of it was. The kind of things, and we had a discussion on the Resilience Committee, Scottish Government Resilience Committee yesterday, and there will be different requirements in different areas, but help to get supplies to vulnerable people, help to take people to and from hospital if that is required. These are the kind of things that people want to do, and there is a role for people to do, or there may be a role for people to do. We want people to be able to volunteer safely, because obviously we have very firm advice to people to stay at home, so we need to make sure that the contributions and the offer of volunteering is consistent with that. Lots of people are already volunteering, lots of charities are making use of that, local resilience partnerships are already making use of that, but we think there will be merit, which is why we're going to do this, to bring this national portal to help give people that single point of access. So over the next few days we'll be able to give you more details of that. Yes?
We've had quite a lot of elderly people calling in to SCPE saying they don't have food, don't know what to do. It seems like some supermarkets are struggling with demand, particularly with deliveries. Is it time for the government to step in and try to help coordinate something?
Well,
We are in dialogue with supermarkets to try to make sure that people in different vulnerable groups, if I can call them that, are getting priority, and that will be an ongoing dialogue. We are also having discussions. I will personally take part in a discussion later today about the arrangements in different resilience partnership areas for the supply of essential items to those in the, you recall we talked about the shielded group, and that will also include, you know, what more we can do to make sure that nobody right now, whether they're an elderly person or somebody who's vulnerable for another reason, is falling down through the gaps. So that is a big focus of many of the discussions that we're having right now. Yeah.
There was a video posted yesterday by a police force down south saying that people who were driving to, I think it was a Peak District, a rural area, going for a walk, keeping distance, not in contact with other people, the police said they were breaking the law, given we are entering the weekend. What would you say to people? Can they do that, or would they be stopped by police?
We want people to exercise, preferably once a day. We want people to stick to their own, either do it on their own and to stick as far as, to stick to their own household group. The key thing here is not going outside of your own household group, and preferably to do that as close to home as possible, because obviously the further away you go, the more likelihood is that you're going to come into contact with people. And there was a big concern last weekend about parks and beaches being crowded. But I know the police are taking a very sympathetic approach to how they seek to enforce this. They want to make sure that the guidance, which is now encompassed in rules and these regulations, is adhered to for the good health reasons, but do that in a sensible and proportionate way. Do you want to say more about the do's and don'ts of exercise?
And we can't emphasise enough how important, especially at this time, that exercise is very good, but both for your physical health, but also for your mental health and well-being, and for everyone to get an opportunity to do at least something outside. The risks really of if someone has the virus and isn't aware, they're living in their own household, of them transmitting to others, is why we've put the social distancing measures in. So hence the exercise to be taken in your own household group, and stay away from others if you meet others while out walking. The travelling in a car, if it's again within your own household group, then that's not any more that you're more or less likely to become infected. And I think, as the First Minister has said, one of the things we really want to stay away from is crowds at particularly busy or beaches, hills, parks, and we did see that in the good weather. And so to some extent, that discouraging of travelling to particular spots that are well known, we really wouldn't want people mingling together there, because that risk of a big spread from one or two people who are infected amongst a big group, they go home to their own households, and that exponential spread that we're really, really trying to avoid.
So in the interest of giving as much clarity as possible and recognising that you can never cover every eventuality and scenario, is stay within your own household group, stay away from people outside your own household group, stay as close to home as it's feasible to do, to get that exercise that is important for physical and mental health. And when you're coming into contact with people outside your own household group, make sure you're respecting that social distancing advice that is there. Right, any final questions? Yes.
Registered with Scotland closed their application record, which has caused quite a lot of concern for people who have sales pending, trying to go through, and now sales have fallen through at the moment. Is there any advice or guidance?
I will look at that with a view to putting out some proper answer to that and proper advice, rather than doing it right now before we've really come to a view on exactly what it is we're saying on that. Very quick one.
Will your daily briefings now moving to
Yes, apparently they are. So we're going to be saying hello to you on a screen from, I think, Monday onwards. So I look forward to seeing you all in virtual reality as opposed to physical reality for the next wee while. Thank you all very much.